Obviously, we've had COVID on our mind, right? But actually, what we found is really over the last 12 to 18 months or so, flu has now again become the bigger problem. Admissions from flu, even death from flu now far outpace COVID.
Now to a healthcare wake-up call amid a whole new era of vaccine hesitancy. Local experts urging all of you out there to remain vigilant, especially about COVID, but do not forget about the flu. We're entering the season. According to the most recent data available from the CDC, more than 500,000 Americans were hospitalized during the prior season last year, and some 28,000 people died because of the flu. Robbie Owens reporting on how community safety nets are getting ready.
If Dallas County catches a cold, flu or COVID,
we always prepare for the worst and hope for the best.
The consequences will be felt quickly at Parkland Health.
And so we are stocking up on both of those vaccines. We're going to do flu drives just like we always have.
Dr. Joseph Chang is Parkland's chief medical officer.
But the thing that maybe worries me is that the public has forgotten. The public has forgotten how sick people can get, whether it's COVID or the flu. It's vaccination, vaccination, vaccination.
Local medical support for science-based prevention comes at a time of national turmoil. Under the direction of Health and Human Services Secretary Robert F. Kennedy Jr., a vaccine skeptic, the FDA recently authorized updated COVID vaccines, but limited their use for most age groups. The vaccines are approved for seniors 65 and older and those with underlying health conditions. The emergency use authorization that allowed healthy young children to get the vaccine has been rescinded.
Something is wrong in the U.S. with public health. You cannot dismantle it and expect it to function. Something is wrong when politics rules science.
For senior officials with the U.S. Centers for Disease Control and Prevention have resigned in protest of the recent changes, citing what they call growing political interference with the agency's scientific work, particularly regarding vaccines.
We needed to stand together and try to do what we could to raise the alarm around public health in our country.
How concerned are you about the new COVID vaccine recommendations? Do you think it will lead to a sort of nonchalance about people getting vaccinated for all of these viruses as we head into the season?
Yeah, I certainly hope not, Robbie. And I think that's a really good question.
For the answers that matter most, Dr. Chang suggests a conversation with your physician.
So even if you don't think you fit into those criteria, maybe you actually do. So definitely go see your doctor and get a professional opinion, not Dr. Google.
Doctor's orders from Dr. Chang. In Dallas, Robbie Owens, CBS News, Texas.